Tonight. Linda Spiegel is here, she was here day one, and Susie's here, she was here day one. And the schedule for this year actually is not fully completed. We're not doing one in October because of the holidays, but I can read off to you quickly what's anticipated after that. Okay. So November 19th, I'm going to be speaking. Okay. Actually, yeah, that's right, okay. She made one mistake here, okay. And I'll be talking on November 19th, so that'll be the third Tuesday of the month, so it's not to conflict with the women's Arthritis Kala event, and my usual talk about updates in medicine. Love to see you all here. We have a gastroenterology one scheduled for December. A rheumatology one on common types of rheumatic conditions with the Hill Zuckerman in January. We have one, kidney stones and prostate health by the chief of urology, who's terrific. We have one on vascular disease in March by the chief of vascular, who's terrific also. We have a cardiology one, topics to be decided. In April and May, we have something really unique. We're going to have two people here who are not physicians, but they're going to talk about medical billing and insurance and patients' experiences, and let you know the real bottom line as to why and how things work in hospitals. I don't know that myself. And then we have a GYN one scheduled for June. So that sounds really exciting. As usual, they'll be held on Tuesday evenings, except the one exception in November, the second Tuesday. I don't think any holidays interfere. Oh yeah, the one in April will be after Pesach, okay. Tonight, this gentleman has been here before. He has impressed the joint. He is Associate Director of Joint Arthroplasty, Assistant Clinical Professor of Orthopedic Surgery at NYPQ. He does a terrific job replacing joints, and the art is getting better and better than it ever was. One of the people in the audience has a question. Her husband had bilateral TKRs back in 2005, and he wants to know how long they're going to last.
Great question. Sure.
So I'm going to give that so I don't get yelled at. I have some of his cards right here, and I will give them out to you if you want one. Dr. Aditya Derasari, who actually, you have films of your robotic stuff?
There's an animation that should work. I hope it works.
That'd be
Yeah.
wonderful.
Yeah.
It's going to impress you with some of his artwork.
All right.
Your phone?
Thank you, Doctor. So my name is Aditya Derasari. I'm a joint replacement. Sorry, is that okay? Is that better? It's a little bit okay.
Do I need this, or can I just talk?
Yeah. Okay. Can I just shut it off? Okay.
Yeah. Let's just do that. Okay. So my name is Aditya Derasari. I'm a joint surgeon at New York Presbyterian Queens. By joint surgeon, what I do is do total hip and total knee replacements, along with other fracture works and things like that. The topic for today is going to be treating hip and knee pain. So it's a very common condition. It's typically caused by arthritis, and we'll get into that a little bit. But what I want you guys to take away from this talk, I hope, is a sense of what kind of things are we doing. I should stand. Okay. What kind of treatments do we have for these very common conditions? And should you or somebody you know or a family member end up getting one of these treatments, what can you expect? What's the recovery like? How long does it last? That was one of the things, one of the questions in the audience. So, hopefully you can walk away with some more information that will be useful to you. So this is me. I think I kind of still look like that, but my office right now is I have an office at the hospital. I have an office at Jackson Heights on Northern. And this is just some of my background. I was in Florida for quite some time. Okay, so we're gonna talk about what joint pain is, treatment options, and then kind of getting into to the meat of what I do, which is joint replacement surgery, and then what you guys can expect from a patient standpoint in terms of how to recover, how long is it gonna take to feel better, things like that. And then we can open up the floor for questions. Okay. Are you guys able to see and hear? Okay.
They want the microphone they want.
They want the microphone? Okay.
Yeah.
All right, I'm gonna try to hold it,
Right,
all
is it
right.
on? Right.
Well, I think I was holding it too close, so, is it, no,
Not on.
is that, okay.
All right, is that better? No, this is too much. Okay.
Too much in there.
A little bit too much. Okay, so I'll try to find the just right position here. So again, our hips and knees, joints of our lower extremity, everything you do, you're putting weight. These are called weight-bearing joints. You go up and down stairs, you kneel down, anything, you name it. You know, so if you have joint pain, you're going to be feeling it pretty much in every aspect of your life. So it can really limit your ability to function. Some of the common causes are rheumatoid arthritis, and we have a specialist here who's going to touch on that, so I'm not really going to steal his thunder on that. We also have what the most common arthritis, which is osteoarthritis. We tend to describe it as wear and tear arthritis, so you're getting old, you got arthritis, that kind of thing. But what it really is when the cartilage degenerates. So that can happen through overuse, be it decades of just being on your feet. It can happen if you're an elite athlete, and you're just up and down all the time. And also there's something called post-traumatic arthritis. So if you had a big injury, you were involved in an accident, you had some kind of operation, that cartilage can wear out quicker than a normal cartilage. So again, all that does is basically causes pain in the joints. The hip or the knee joint is what we're going to focus on. Some of the treatment options, you can offload that joint. So if your knee hurts, and don't put as much weight on that side, start using a cane, using a walker. And that's a way to put less pressure on that joint. Heat and ice, that's also a good way to manage your pain and swelling. So what we tell people, if you just had an injury, you want to ice it, get the swelling down. If you have a chronic injury, most people say that heat feels better, it sort of limbers up their joint, makes them feel less stiff. Physical therapy is certainly an option, one of the early options when you have joint pain. Physical therapy is kind of a vague catch-all, but it can include stretching, massage, ultrasound. So a lot of that is left at the discretion of the physical therapist. So, but you can definitely get good results through that. Over-the-counter medications, mainly these are anti-inflammatory medications such as Motrin, ibuprofen, Aleve, things like that. For very severe arthritis, a doctor may start you on steroid medications, but all these medications do have side effects. So the non-steroidal, such as Motrin and Aleve, can upset your stomach. So if you have ulcers, if you have stomach upset, kidney problems, not a great option. And the steroid medications come with multiple side effects that you have to watch out for, but sometimes that is the preferred treatment option for some people. Now, if that doesn't work, and you have these types of symptoms, so one of the professors who taught me, he actually ended up getting his knee replaced, and when I think it was from an old ski injury, so he had just been nursing it along. And then, so people would ask him, well, how'd you know it was time? So he had some young kids, and at night he would say, I don't even want to go upstairs to read them a story because my knee hurts so bad. So he's like, okay, now it's time to get the knee done, right? So, when you start letting go of things that are meaningful to you, and it could be small things like just going up half a flight of stairs or going around the block or to the park with your friends or whatever, and you're not doing that, then. And all these things that we talked about, the non-surgical treatment options aren't working, then perhaps it's time to at least discuss what else can be done, or am I willing to accept the current my current disability, right? So is the joint pain affecting your ability to get a good night's sleep? Is it keeping you what you want to do, less active, things like that? So we're gonna touch upon one of the main treatment options, which is total hip. This is considered to be one of the most successful operations. I think the British Journal came out with an analysis of what surgeries in modern medicine have really made an impact on people's lives, and the success rate for this surgery is over 90%. It's a very successful surgery. So here we have a model of a pelvis on your left, and if you look, does this have a laser? I don't know. Maybe I can.
What?
Is there like a pointer here, or
What,
like a little
Laser.
laser pointer, or no?
is that working?
I don't know. I don't want to blind anyone.
Oh.
Yeah. It was advancing. I just want to make. Oh, how'd you do?
This button.
Oh, thanks, Al. Okay, great. Okay, so if you look here. Oh. Sorry. Okay. So if you look here, is a normal hip joint, and you can see that it's nice, shiny, smooth cartilage. And this is an arthritic or a worn-out joint, and you can see it kind of looks like something a dog's been gnawing on for a while. All right. So all that cartilage is gone, and now you have lots of friction. And every time you try to go up and down the stairs, or you try to walk, or bend down or kneel, that friction creates a cycle of inflammation and pain. So that's no good. All right, and these are the X-rays. So orthopedic surgeons love X-rays. We can't get enough of them. So you can see that there's space between the bones here. This is the femoral head of the thigh bone. This is your pelvis, and you can see there's a bit of space there. And over here, the joint has been pushed outwards, and it's also what we refer to as bone on bone. So there's no cartilage. There's no cushion, and you can be pretty sure that person with that X-ray is in quite a bit of pain. So what we do to treat that condition, once all the other non-surgical treatments that I went over have already been attempted and failed, is a total hip replacement. Okay. Let's see. Let me see. Maybe. That's it. I know for sure there should be more slides.
1 second.
Yeah, try
Which floor are we up to?
Yeah. Actually, no,
one up.
number 15. So I think it was probably like
From current slide.
I think it's probably an animation that didn't go.
I'm supposed to go do the lap, but I just didn't do it yet. I had other things going on in my life. I just,
Yeah, no problem. I think we might have to close it out, maybe, and open it up again. Just.
it's my fault. I should have.
Oh, wait, actually, here we go. So maybe just skip.
Go to 16?
Yeah, can you just open that up, maybe, like go to like slideshow, see if that works.
Sure.
Slideshow.
Let's go to 16. We're
then,
stuck.
yeah. Full current slide. Okay. All right. So this is what the X-ray looks like after the hip replacement has been done. So, and this is what we're just going to skip that slide. I don't know if it's corrupt or something, but so this is a part of the hip replacement that goes into your thigh bone. This is the part here that goes into your pelvis, and this is what we call the bearing surface. Okay, so that's the femoral head, and that's a plastic liner. So when people say, "Oh, how long is my hip going to last?" Right, or "How long is my knee going to last?" What really wears out? The metal doesn't wear out. The metal grows into your bone, and that's there permanently, unless something bad happens, like an infection or something. What wears out is this plastic part, and that will wear out 20 or 25 years. Okay, so just something to keep in mind. So total knee replacement is a similar concept. All right, you have smooth cartilage that has been replaced by arthritis or diseased cartilage. pain, inflammation. Here's some, this is a normal, healthy knee over here, and then you can see over here, there's no gap between the bones, right? So there's no gap between the bones, and there's pain, friction. And again, here's a little factoid here. For every 1 pound you lose, you take 4 pounds of pressure off the knees. So one of the first things we tell people if they have an arthritic joint, get at a healthy weight, you'll feel better. But you know, even this guy right here, even if he weighed 100 pounds, he'd still have knee pain because there's absolutely no space between those bones. So
Does that pain come the front of the knee typically or the back of the knee?
is
Pain, is typically in the front of the knee or the back of the knee?
what is?
The pain.
Oh, the pain, it can be everywhere. So what happens is the joint capsule has pain fibers everywhere. So even if the arthritis is localized on one area, for the most part, it'll be sort of global knee pain. Yeah. Unless you have it only in one area, but for the most part, it can be throughout the knee. Yeah, it's a great question. So I'll go over the common treatment, total knee replacement. I'm sure everyone knows someone who's had one, or a friend or a family member. And you probably had you've heard the good and the bad from your family members as well, I'm sure. Oh, here we go. What happened? I think we're hitting like a video that is just taking too long. It might be like overwhelming the laptop.
Yeah, you know, I was supposed to replace it, I just didn't do it yet.
No, that's fine. So maybe I'm gonna have to do what you did last night. So, yeah,
Which one up to?
that one.
26?
26. Yeah. So, it's not a great slide, but anyway, this
I'm
kind of.
sorry, it's my fault.
No, it's fine, it's not a big deal. So anyway, we have here just, well, this is a really bad figure, but basically, depending on where your arthritis is, if it's only in one part, you can get a partial knee replacement, but for most people, we tend to do total knee replacements. This is what it looks like after the joint's been replaced. So you can see now that instead of the bones grinding on each other, you have artificial parts made out of metal and plastic, and there's a space between the bones here, and also a space between the bones there that allow you to bend your joint. And this is what these implants look like. So you have total knees and partial knees, and then this plastic part allows for smooth, frictionless gliding of your knee joint. So, and again, that plastic part is the part that wears out. So let's see if this works. It really would be great if we can. Let's see. Okay, so I want to kind of get into some of the new things that we're doing at the hospital. One of the things that we're doing is robotic arm-assisted hip and knee replacements. So this thing is controlled by the surgeon. There's a little trigger here, and it's a saw that's attached to an arm. And what that does is it locks in, it locks the surgeon in to make very specific and accurate cuts to the bone so that you can get excellent clinical results. And these are some of the benefits. These are papers, or some of the, not to really go into it, but it helps you perform the surgery more accurately, so it can lead to lower pain scores, quicker recovery, and a feeling of a more natural joint. And it's being done all over the world now. So let me see if I can get this. Howard, do you think you can just play it? So I'm going to show you. It should be like if you go scroll over here.
What do you want to do?
On the main one. Yeah, if you want.
Oh. I need to go to the
Trying to see if I can show you, get this to work for you guys. All right, we got music, but I don't know if we're gonna get, I don't know if we're gonna get any.
Let's take a look at how it works. It begins with a CT scan of the knee joint.
Guess I'm not getting it.
Yeah, I'm gonna have to replace this thing.
Okay, it's okay, but I can talk you through it. So, yeah, so the way it works is, there's a CT scan that's done before the operation, and that CT scan is registered during the surgery to your own bone, okay? And what that allows is, it allows the robot to dial in and make very specific cuts. So it leads to better results, more accurate, precise results in both knee and hip replacement. So we have that here. We've had it since 2017 at the hospital. I've seen really good results with it. I want to talk a little bit about recovery from joint replacement. So,
Slap me up to
yeah, please.
36.
Yes. So again, the way it works is you have the surgery, and then you're in the hospital for a couple of days, and then you either go home and you get a nurse or a physical therapist, or you go to a rehab facility. And I know we have some excellent rehab facilities in the neighborhood here, so, and typically people will stay about 1 or 2 weeks. You see your doc, and then you see us back out in 1 year, just to make sure everything's going well. In terms of what to expect, for the first 3-4 days, you're gonna have some pain, tightness, swelling, and that's just part of the initial recovery. And then afterwards, for the first, say about 2 to 4 weeks, things start to get easier, and you start to be able to go outside and do things. And most people, we tell them that at the 1 year mark is when you're fully recovered. But in that first month and a half, 2 months, you're about 70-80% of the way recovered. So just what you can expect, and these are the kind of things that people can get back to, and these are the kind of things that you probably should not start. So, I wouldn't pick up karate right after your hip replacement, all right? But walking, dancing, all those sort of low impact things that aren't causing stress on the implants. So if you were to even do any of these activities, nothing bad would happen. Your joint replacement, that plastic that I talked about, might not last 25 years. It might last 15 years if you started running marathons or something like that. But just something to keep in mind. Just going to open it. Yes.
You mentioned the plastic.
Yes.
You're using polyethylene